A team-based healthcare approach is the way to do it in the 21st century. Hey folks, Dr. Jeff Williams here with Creekstone Integrated Care right here in Amarillo, Texas. I'm coming to you again this week with a new video. This one is on how a team-based healthcare approach isn't only a good idea, but it's now a recommendation. Let's start by defining the term team-based healthcare. What does it mean exactly? Well, let's shorten it to TBH to save just a little bit of time. TBH means treating a patient from all aspects with an integrated healthcare team to effect the greatest change you can for your patients. When a team of healthcare practitioners are involved with a patient's care, the winner is the patient and the loser is pain. You might wonder, what kind of a team am I talking about here? Well, recent research suggests that it is helpful to have maybe a team leader to essentially triage musculoskeletal pain patients upon entry into the healthcare system. Now, this strategy works in the emergency departments as well as it works in a fully integrated clinic. The team leader may be a doctor of chiropractic, like me. It may be a medical doctor. It might be a doctor of osteopathy or a DO. It may be a nurse practitioner, also known as an NP, or it may be a physical therapist, also referred to as a PT. This model has been tried in all kinds of ways and has shown to be superior every time you have a team approach. Basically, the team leader assesses each new patient and directs their care from that point. If it's complicated and it's emergent, well, the patient's directed straight to the medical doctor or the DO. If it's non-complicated, or maybe the nurse practitioner. Now, again, if it's non-complicated musculoskeletal pain, the patient is then directed to the chiropractor or the PT for conservative care. And it's a simple model referred to as a hub and spoke, and was most recently employed near San Francisco in the hospital in the emergency room to relieve uncommon stress on the staff as a result of the COVID pandemic. This same idea has been used in many hospitals and clinical settings around the nation. And in the most current and high-level settings, it's still being used to great effect. The days of lone wolf treatment are really going by the wayside. And what I mean by lone wolf is when a doctor used to try their very best to treat anything and everything that might be wrong with a person in one treatment, in one appointment, trying to be everything to everybody. Well, it's never a good idea. And it's become more and more obvious that the human body is much more complicated than that. That sort of thinking is pretty much outdated and simply not very effective. I would even go far enough to say that if you go to a healthcare practitioner that claims to be able to solve any problem and all problems all by themselves and that they know everything, well, you may want to take a long, hard look at your decisions going forward with them. Chiropractors for years have been saying that we can treat neuromusculoskeletal pain and we can treat it better than just about any other healthcare practitioner out there. The reasons chiropractors are still only seeing about 10 to 15% of the population at this time, the reasons are varied. One explanation is that some chiropractors have made it rough on others by making some claims that are unsubstantiated in the research literature. Some have created a reputation for the rest of the community that they're seeing patients too many times, too often, and potentially creating dependency of the clinic in the patient's mind. And while this has been something many evidence-based, patient-centered chiropractors have had to battle over the years, in the 21st century, the medical field seems to have started to come around more and more to the idea of working with evidence-based, patient-centered chiropractors. This type of chiropractor uses spinal manipulative therapy with their patients, but they also use a big toolbox of other modalities to get their patients better. Tools like exercise rehabilitation, exercises that are targeted to the very specific issues of the very specific patient. Low-level laser is excellent for inflammation, sprains, strains, and injuries. Balance and proprioceptive training, decompression for disc bulges and disc herniations, as well as disc degeneration, massage and soft tissue modalities, and even acupuncture. The medical field is even at the point now that one of their largest nationwide organizations, called the American College of Physicians, the ACP, now recommends spinal manipulative therapy, exercise rehab, massage, low-level laser, heat, and even acupuncture as what a patient should do first for back pain. First. Evidence-based chiropractors typically do all of that in just one office, under one roof, which is still team care. A chiropractor with an acupuncturist, with massage therapist, and exercise and all of that stuff is a team. Therefore, according to the ACP, American College of Physicians, it's not only appropriate, educated, and responsible, but it's also recommended for your medical doctor or your medical practitioner or the emergency room. It's now appropriate for them and recommended to send you to an evidence-based chiropractor as your first stop on your journey to get out of back pain. The ACP is not the only organization recommending this course of action. The Joint Commission, the White House's report on opioid abuse, the Lancet Medical Journal, and on and on and on. Big entities doing this. They all have warmed up to spinal manipulative therapy. In fact, the research is so good on spinal manipulative therapy nowadays for back pain that now many PTs are using it in their clinics. Not to mention the fact that the DO, or the doctor of osteopathy profession, that profession was built on using spinal manipulative therapy, and many DOs still use it. So why would a person think a chiropractor using it would not be effective or may in some way be dangerous? How's that even in the conversation? And I would argue it is most effective when being used by a chiropractor that has trained mostly on spinal pain their entire career. There was a poll recently by Palmer Gallup that showed most people that don't treat with a chiropractor, they don't treat with a chiropractor due to mistrust in the chiropractor, and because they perceive that going to a chiropractor may be unsafe. Now, to that point specifically, let me just say that if all of those medical entities that I discussed or mentioned, if all of them are now essentially saying that it is backed by the research literature and you should go to a practitioner that performs these things, for example, a chiropractor, well then trust and safety should no longer be a valid concern. Now, picture this type of clinic and you should see why a team-based healthcare approach makes so much sense. So a patient goes in with low back pain. The director or the hub staff member examines the patient. It is determined that the patient has a herniated disc in their low back, but it's non-complicated, which means there's no emergency here for this patient, so no shots and no surgery for right now. So the patient is directed away from invasive or pharmaceutical care initially. They are directed toward safe, conservative, non-pharmaceutical care with either a chiropractor or a PT. Now, I'm a chiropractor, so we'll go down the chiropractor route, okay? I would evaluate the patient and do things like determine whether they have a direction of preference and to determine which kinds of targeted exercises will give us the biggest bang for the buck with this specific patient. I would also give recommendations to the patient about which movements or exercises should be avoided. Not only which ones do we want to encourage, but which ones do we want to avoid. And then we'll look towards treatment with gentle spinal manipulative therapy. Nothing rough to start with for sure. Now, I'm never rough anyways, but certainly nothing aggressive. We'll use movement-based exercises like we talked about, directional preference exercises, potentially low back decompression, which is highly effective for discs, low-level laser to get the inflammation down. Then we would consider a discussion on how they need to be walking and moving at home. Don't go home and lay in bed. That's a terrible idea. We'd talk about how to use their back correctly to remove the problem or the trigger that created the pain in the first place. Now, if this patient were severe in a team-based healthcare model, we could always, and it would take very little effort, to refer the patient to the medical doctor or the DO or the nurse practitioner for a low-level painkiller and maybe a muscle relaxer. It depends on what they prescribe, but it could help the chiropractor or the PT have more time to get the patient over the pain hump and on track to getting rid of that back pain. But discs have a reputation of healing, and sometimes the patient and the doctor just need a little bit of time. So the MD, the nurse prac, or the DO can sometimes provide that time that we need. If the chiropractor doesn't seem to have the answer, well, the patient could always be referred to the PT for further evaluation, or vice versa. If the PT is not getting results, send over to the chiropractor and see if they can. That's team-based. Ultimately, if the patient fails conservative care, well, the patient can always be sent to the medical doctor, the nurse practitioner, or the DO for further medication, up to and including the use of shots and/or surgical means. Now, I'll give you a quick look at the other side of the coin for an example. I had a patient in my office just this week. They had low back pain. It wasn't disabling or anything like that. There was no difference in their bowel or bladder function since their pain started, no deficit in sensory or motor skills. Yet, right off the bat, the patient not only got prescribed pain pills and muscle relaxers, but they also got a steroid shot. These are things that they did not need and were not recommended by the governing entities in the profession. And basically, it's just lazy treatment, an uneducated treatment, if I may be so bold. Again, the American College of Physicians and all of those other medical entities that I mentioned, they recommend non-pharma conservative care first, followed by low-level pharma, followed by high-level pharma, and assuming all of that stuff has completely failed as you went down the steps, well then, and only then, are shots and/or surgery appropriate. That's the only time. On their own, this patient made it to safe conservative care, and they're doing great, which is how it should have been from the start for them. We still have many practitioners out there trying to flip the model completely upside down and doing whatever they've always done rather than listening to the big boys in the healthcare industry and following new guidelines. A truly team-based healthcare model is the picture of the best way to manage a neuromusculoskeletal patient. A team-based approach is not only a good idea anymore, it now has been tested. It works. In fact, it works exceedingly well, to the point that it's now a recommendation. It is shown to be better for patient improvement. It's less expensive. It's more efficient. Higher patient satisfaction. Less x-rays and imaging. Less shots and pills. And most importantly of all, less surgeries. A team-based healthcare model is truly the way to go in the 21st century. Again, I'm Dr. Jeff Williams. If you're from Amarillo or traveling to our area and we can help you, give us a call at 806-355-3000. Get on our schedule. You can visit creekstonecare.com. We'd love to help you out. If you're watching on YouTube, please subscribe and share. If you're watching on Facebook, a like and a share, it would make us happy. Until next week, stay safe and healthy, and we'll see you then.